Hi, my name is Joanne Vogle, and I'm the Director Clinical Coordinator for Integrated Pain Care at Matthews VU. Matthews VU provides healthcare for children and adults, but also integrates many aspects of specialty care into their program. Integrated pain care is very different than traditional pain care programs. In order to understand the differences, one needs to understand pain and different kinds of pain and how they're treated. Pain, first of all, is understood as being an unpleasant sensory and emotional experience that involves both physical symptoms as well as feelings and thought. It's associated with actual or potential tissue damage usually, but also it's important to remember that patients describe their pain in terms of such damage with or without actual damage being present. Chronic pain is one of the most common causes for seeking medical care and may be the result of incurable medical disorders such as cancer or incurable nervous system disorders such as multiple sclerosis, but it may also be the result of a curable condition that just was not treated properly in the past, or post-operative pain or post-trauma pain that lasted longer than anyone expected. Basically, there's two types of pain, acute pain and chronic pain. And acute pain comes on suddenly, caused by something specific. It can be mild, lasting a short time, such as with a burn or a cut, but it can also last weeks and months, such as after some surgery. It usually, however, does not last longer than 6 months and goes away once the underlying cause of the pain heals. Chronic pain, however, is ongoing and usually lasts longer than 6 months. It continues even after an injury or illness that caused the pain originally has healed or gone away, but the pain signals remain active in the nervous system. Some people suffer chronic pain even when there is no past injury or apparent body damage. Some examples of chronic pain disorders are headaches, arthritis, back pain, and fibromyalgia. Chronic pain affects one's family life, work, and finances due to levels of stress. It can cause unbearable tension in the home as well as within the person's body and limit their ability to move around, sap their energy, and cause appetite changes. It can also bring on things like depression, anxiety, anger, insomnia, and fear of re-injury. That fear can lead to loss of job, income, stop leisure activities that bring enjoyment. Pain perception is affected by many things. In the case of acute pain, most of what people perceive as pain is due to tissue damage. Thoughts, emotions, and social factors take a back seat. However, with chronic pain, tissue input is minimal. It's only about 10% of what a person is actually perceiving. And those pain signals are being affected largely by thoughts, emotions, and social factors. There's also differences in treatment focus. With acute pain, you're focusing on healing the injury, preventing complications such as infection, returning the person to previous levels of functioning if possible, rest, and pain elimination while they're recovering. With the chronic pain, your focus is very different. You're reducing the impact of pain on a person's function, and you're increasing activity levels instead of decreasing them. You're teaching the patient how to manage his or her pain and feel more in control and less helpless, reducing the impact of thoughts, feelings, and other behavioral influences on their pain perception, and encouraging them to use self-care and prevent aggravating their pain, rehabilitating them, and maintaining function. Multiple pain contributors require integrated care with multiple modalities. It's very goal-oriented. It will include interventional treatments if appropriate, which may include more surgery, or pain interventions such as injections. It will include some mental health aspects, such as teaching the patient how to manage their pain, set goals, manage stress, help with their sleep, manage their depression and their anxiety. It will include medications of many different sorts to manage different types of pain more appropriately, and certainly to manage their sleep issues and depression issues. There's also a big focus on movement and exercise, which could mean physical therapy or home exercise. It may also include alternative therapies such as chiropractic and self-care modalities, as well as braces. So there's many different aspects to integrated pain care. That care is woven into overall care and takes into consideration medical conditions such as blood pressure, COPD, diabetes, and mental health treatment. There's close communication with your primary care provider and takes into account social factors such as transportation, family, support system, and finances. But the focus is always on goals and function and not just rating your pain. It helps put you in charge instead of your pain managing you. Caring for people in pain means acknowledging that you have pain and that we believe your pain exists and we want to help to alleviate it and make it easier for you to not just to endure your pain, to move forward with your life and have some quality of life. Thank you for listening.